Hello, I am Dr. Shafir Rahman. I am graduate of Khyber Medical College, Pakistan. Recently, one of our literature review regarding histiocytic sarcoma occurring secondary to gastrointestinal stromal tumor was published in Cureus journal. First of all, I would like to thank my all co-authors for working diligently on this literature review. So our aim of conducting this literature review was to look into demographics, clinical signs and symptoms, histopathology, immunohistochemistry, and molecular analysis when histiocytic sarcoma occurs secondary or concomitantly to gastrointestinal stromal tumors. So upon literature research, we have found only 2 case reports and 1 conference abstract regarding this unique concepts. So according to the findings of our literature review, there were 2 males and 1 female as per gender distribution. The mean age of presentation was 59.6 years. On immunohistochemistry, CD marker 68 was found positive in all 3 patients and CD 163 was found positive in only 2 patients. On molecular analysis, in 1 patient there was KIT mutation on exon 11. On histopathology, emperipoiesis was found only in 1 patient. Emperipoiesis is the presence of cell in another cell cytoplasm, and it is known as a characteristic feature of histiocytic sarcoma. So there are certain hypotheses which have been proposed regarding emergence of histiocytic sarcoma from GIST, and one of that is the concept of the transdifferentiation. Transdifferentiation is basically convergence of one cell type into another cell type without going into any intermediate cell lineages. So basically what happens that interstitial cells of caudal of GI tract can lead to gastrointestinal stromal tumors, and ICC are emerged from mesenchymal cells. And the receptors which is responsible for fully differentiating mesenchymal cells into ICC is known as c-KIT, and hence it will produce the KIT signaling. So it is proposed when there is an impediment of KIT signaling, what happens that ICC can transdifferentiate into smooth muscle cells. So therefore Tong et al. In one of our case reports have put forward this hypothesis that when imatinib is given for gastrointestinal stromal tumor, so along with imatinib and other intrinsic host responses like immunosuppression and other tumor microenvironment can possibly lead towards transdifferentiation of GIST into histiocytic sarcoma. The other strikingly important concept is that whether there are any similarities between genetic profile between histiocytic sarcoma and GIST. So till date, we haven't found any genetic similarities between histiocytic sarcoma and GIST. However, histiocytic sarcoma shows a lot of genetic similarities in multiple cases with B-cell lymphomas. So therefore, we propose studies on a large scale so that we should basically understand the real relationship between histiocytic sarcoma and GIST. So therefore, rare cases like this has to be put forward in front of the medical community so that we can understand the genetic makeup and immunohistochemistry of such rare coexistence. So currently, my area of interest is to look into the immunosuppression role into the emergence of histiocytic sarcoma. So this is another concept, and I am currently doing literature review regarding any sort of role of immunosuppression and emergence of histiocytic sarcoma. So immunosuppression by any means like transplantation medications or diabetes or HIV or any sort of disorders of immune system can lead towards histiocytic sarcoma or not. This is my another area of research. Thank you.